November is National Diabetes Awareness Month, and according to the Centers for Disease Control, 30 million Americans are living with diabetes, and the numbers are on the rise among children and teens. Carloee McGrath sat down with Dr. Chelsea Gordner, an endocrinologist from Baystate Medical Center, to learn more.
So type 1 diabetes is probably the less common cause of diabetes. Is what we used to call juvenile onset diabetes. Happens more so in younger individuals, and the body really stops making insulin, and so the only treatment option we have is insulin.
Okay, and so what are the symptoms? Like, how would you know that your child might be suffering from this?
The symptoms in type 1 diabetes happen pretty quickly. So over just a few days often, you have excessive thirst, excessive urination, excessive hunger, and often weight loss. And you can get very sick very quickly within 2 or 3 days with type 1 diabetes.
And how do you manage that? What are the treatments today? I know we've come a long way.
We have come a long way. Insulin's been around since 1921 or so. It is a mainstay of treatment. Usually there's 2 forms of insulin that most people use, a long-acting insulin that you take once a day, and then a short-acting insulin that you take with meals. But you mentioned technology, and we've come a long way. Some patients will use things like insulin pumps, which is another way to treat type 1 diabetes.
And what is the dietary restrictions?
I think a lot of individuals that aren't as familiar with type 1 diabetes believe that patients are, very restricted. They can't eat carbohydrates, they can't eat sweets, cookies, ice cream, etc. Especially when we're dealing with young individuals, children. We don't like to restrict those foods. It's all about moderation. And so we try, for all patients, try to encourage a healthy diet, but we match the insulin up to what they're eating.
Okay, so let's talk a little bit about type 2 diabetes, which I guess used to be referred to as adult onset diabetes.
So type 2 diabetes is definitely more common than type 1 diabetes. Happens more common in adulthood, but we are seeing it more often in younger individuals, even as young as 10, 12, 14 years of age. That tends to be more related to being overweight, having certain genetics, not exercising, those sorts of things.
Can that be reversed if you, lose weight, for example? If you take weight off and you start monitoring what you're eating, can that be reversed, or are there still certain treatments for that?
That's a good question. Some of it comes down to semantics. We call it diet controlled. If you had type 2 diabetes and you lost weight and then you're able to maintain it with your diet, there's been really good studies showing that weight loss surgery can reverse diabetes and can make diabetes go away to a large extent for many years.
Okay, are the symptoms the same with type 1 and type 2?
Great question. The symptoms with type 2 diabetes, because it's related to being overweight and your lifestyle, they often can be longer term. So you may have excessive thirst, excessive urination for weeks and months before you're diagnosed. But the same apply. Being excessively hungry, losing weight, drinking excessively, urinating excessively, and then blurry vision. You can have blurry vision as well.
What are some of the links with the type 2 diabetes? I know heart disease is one of them, but explain some of the other links and complications that come from that.
Type 2 diabetes, because of the chronically high blood sugars, affects all of the cells in your body. And the ones that we find the most are the eyes, the kidneys, the nerves in your feet, and the heart. And so there is, as you mentioned, a link with heart disease. Patients with diabetes are at risk for developing heart problems. And so we have to make sure that everything is in control, the blood pressure, the cholesterol, and we focus on healthy eating and exercise.
Now, let's say people, don't follow that healthy eating and exercise. What can happen if that gets out of control?
Well, it certainly can impact the blood pressure. It certainly can impact your diabetes control, and it increases the long-term risks. Things like strokes, things like heart attacks, things like increasing the risk for amputations.
Okay. You were mentioning the numbers are up, in teens and children with both type 1 and type 2 diabetes. What's behind that?
Well, the type 2 diabetes in younger individuals we think is relating to the obesity epidemic. So more kids are overweight, less kids are exercising. We see it also more so in Hispanic individuals, African American individuals. So genetics does play a large role.
Okay, but type 1 as well is on the rise?
Type 1, we're not really certain as to why type 1 is on the rise, but it is on the rise in younger individuals. We think that autoimmunity probably is playing a role. The underlying pathology of type 1 diabetes is your immune system attacks the cells that make insulin, and so it is a form of an autoimmune condition. So similar to seeing more nut allergies, food allergies, we're seeing more autoimmunity, and this is one of those autoimmune conditions.
Okay, something that affects women, gestational diabetes during pregnancy. Talk about that condition and also the risks for the baby as well, long term.
So women who are overweight, who gain excessive amounts of weight, and of certain ethnic minorities are at risk for gestational diabetes. And just as you said, that does impact the baby long term. And so if the baby ends up being large as a result of the gestational diabetes, that baby has a risk of developing diabetes.
Okay, so how do you go ahead and treat the mother during pregnancy and then monitor that child all the way through?
So we do monitor the mothers very closely, and they have very stringent sort of targets during the pregnancy to try to keep her healthy and the baby healthy. And we just try to encourage healthy eating, exercise during the pregnancy, and preventing an excessive amount of weight gain. But you're right, that baby does need long-term, lifelong monitoring really. If the baby is born excessively large or excessively small, it does increase risk for the baby.
Does breastfeeding help with that at all?
Breastfeeding increases, it helps control the weight of the mother after birth, and so that doesn't impact the baby so much, but it helps the mother's long-term health.
Okay, and let's just talk about the importance of having a National Awareness Month for diabetes. Why is it so important to get this message out to people?
There are so many Americans that are undiagnosed with diabetes, and they have these symptoms for years and already develop complications. If we're able to pick up these subtle symptoms early, we can start intervening with lifestyle changes, healthy eating, and maybe medications.